Welcome to another nursing review on pharmacology. Before we begin, let's see if you can get this question correct. The patient with iron deficiency anemia is given an oral prescription for ferrous gluconate. Which should the client learn from the nurse? 1. Take the over-the-counter anti-diarrheal medication Imodium for diarrhea. 2. For a few weeks, limit your exercise until you reach a tolerance. 3. Blood may be obscured by the extremely dark feces. 4. For protein, limit your diet to red and organ meats. Put your answer in the comment box below. Now back to the lesson. This lesson will focus on antianemics. We will first learn about the actions of this medication, adverse reactions, and contraindications. Antianemics are used to treat a number of conditions such as iron deficiency, RDA, megaloblastic or macrocytic anemia from folic acid or other dietary deficiencies. It is also used for cancer patients undergoing chemotherapy and used to decrease the requirement for allogenic blood transfusions in surgical patients. Now let's talk about how it functions. In the bone marrow, epoetin promotes the synthesis of red blood cells. Hemoglobin synthesis requires elemental iron, which is provided by ferrous fumarate and ferrous sulfate. Normal erythropoiesis and nucleoprotein synthesis are stimulated by folic acid. Okay, now, let's move on and learn about adverse reactions. Fatigue, headache, weakness, nausea, vomiting, diarrhea, constipation, rash, and urticaria are all possible side effects of antianemic medications. Okay, this is important. Let's now learn about contraindications of this medication group. Patients who are hypersensitive to any of the drug's ingredients should not take it. Epoetin alpha should not be used to treat tumors that have the potential to be cured or to treat patients with breast, non-small cell lung, head, and neck, lymphoid, or cervical cancers. Okay, so now that we have a good idea about how this class of medication works, let's now focus on the commonly used medications of this class, starting with epoetin alpha. Epoetin alpha is used to treat anemia brought on by chemotherapy, zidovudine therapy in HIV-positive individuals, or chronic renal failure. Additionally, it helps anemic patients who are scheduled for elective, non-cardiac, non-vascular surgery avoid the need for allogenic blood transfusions. This drug specifically functions by mimicking the effects of erythropoietin by increasing the synthesis of red blood cells by acting as a growth and differentiation factor. Side effects are the following. With the central nervous system, side effects are asthenia, dizziness, fatigue, headache, paresthesia, seizures. Cardiovascular side effects are edema, hypertension, increased clotting of arteriovenous grafts. Gastrointestinal side effects are diarrhea, nausea, vomiting. Metabolic side effects are hyperkalemia, hyperphosphatemia, hyperuricemia. Musculoskeletal side effects are arthralgia, and respiratory side effects are cough, shortness of breath, and upper respiratory infection. All right, great. Let's now study the nursing actions for this drug. Keep the solution refrigerated and out of direct sunlight. Don't dilute or shake. If the solution is discolored or contains particle materials, do not use it. Think about prophylaxis to avoid deep vein thrombosis. Patient education follows nursing interventions. The patient should be taught the following points. Advise the patient that after the injection, which normally happens within 2 hours, they may experience coldness, perspiration, and soreness or discomfort in their limbs and pelvis. After 12 hours, the symptoms are expected to resolve. Tell women to think about the necessity of contraception and that they might start menstruation again following therapy. Ferrous fumarate. Ferrous fumarate is used to treat iron deficiency and also acts as a supplement during pregnancy. This drug specifically functions by supplying elemental iron, which is necessary for the synthesis of hemoglobin. Side effects are the following. With the gastrointestinal system, side effects are nausea, vomiting, constipation, diarrhea, black stools, and GI irritation. Other side effects include temporarily stained teeth from suspension and drops. Okay, excellent. Now let's learn about nursing actions for this medication. It is better to take doses in between meals. Certain foods can be taken with this medication, though absorption may be slowed down. Give medication with water or juice. Orange juice is best to improve absorption, but not with antacids or milk. Avoid crushing medications, which may result in guaiac test findings that are falsely positive. Keep in mind that oral iron can cause dark stools. Despite being harmless, this could conceal melena. Throughout treatment, keep an eye on the reticulocyte count, hematocrit, and hemoglobin level. With nursing actions comes patient education. Here are some points to teach the patient. Advise parents to keep all products containing iron out of children's reach, and to contact a poison control center or physician right away if an overdose happens by mistake. To prevent tooth discoloration, instruct the patient to take the suspension with a straw and place the droplets at the back of their throat. Remind the patient that different iron salts have different amounts of elemental iron and that they should not be used interchangeably. Encourage the patient to report any changes in the color or consistency of their stool as well as constipation. Ferrous sulfate. Ferrous sulfate is used to treat iron deficiency. This drug specifically functions by supplying elemental iron, which is necessary for the synthesis of hemoglobin. Side effects are the following. With the gastrointestinal system, side effects are nausea, constipation, and black stools. Other side effects include temporarily stained teeth from liquid forms. Okay, excellent. Now let's learn about nursing actions for this medication. It is better to take doses in between meals. Certain foods can be taken with the medication, however, absorption may be slowed down. Give pills with water or juice. Orange is best, but not with antacids or milk. Tablets should not be crushed, as this could result in false positive guaiac test findings. Keep in mind that oral iron can cause dark stools. Despite being harmless, this could conceal melena. Throughout treatment, keep an eye on the reticulocyte count, hematocrit, and hemoglobin level. Cereals, cheese, coffee, eggs, milk, tea, whole grain breads, and yogurt should not be consumed together since they may reduce the absorption of iron. With nursing actions comes patient education. Here are some points to teach the patient. Give the patient instructions not to chew or crush the extended release form. Tell the patient that different iron salts have different amounts of elemental iron, thus they shouldn't be used interchangeably. Encourage the patient to report any changes in the color or consistency of their stool, as well as constipation. Folic acid. Folic acid is used to treat RDA, megaloblastic or macrocytic anemia from folic acid or other nutritional deficiency, hepatic disease, alcoholism, intestinal obstruction, or excessive hemolysis. This drug precisely does this by promoting normal nucleoprotein production and erythropoiesis. The following are examples of side effects: changes in sleep patterns, general malaise, trouble focusing, disorientation, poor judgment, impatience, and hyperactivity are all adverse effects of the central nervous system. Anorexia, nausea, flatulence, and a bitter taste are side effects related to the gastrointestinal system. One of the respiratory adverse effects is bronchospasm. Okay, excellent. Now let's learn about nursing actions for this medication. To reduce fetal neural tube abnormalities, the U.S. Public Health Service advises taking folic acid during pregnancy. For 1 month prior to and 3 months following conception, patients with a history of fetal neural tube abnormalities during pregnancy should increase their folic acid consumption. Parenteral administration may be necessary for patients who have intestinal malabsorption and small bowel resections. Keep the drug at room temperature and shield it from heat and light. Patient education follows nursing interventions. The patient should be taught the following points. Instruct the patient on healthy eating habits to avoid anemia recurrence. Emphasize the value of laboratory testing and follow-up visits. Inform the patient about folic acid-containing foods such as Brussels sprouts, liver, oranges, whole wheat, and broccoli. Let's go back to that question we had in the beginning of the video. The patient with iron deficiency anemia is given an oral prescription for ferrous gluconate. Which should the client learn from the nurse? 1. Take the over-the-counter anti-diarrheal medication Imodium for diarrhea. 2. For a few weeks, limit your exercise until you reach a tolerance. 3. Blood may be obscured by the extremely dark feces. 4. For protein, limit your diet to red and organ meats. The correct answer is 3. The dark green-black color of the feces may conceal the presence of blood in it. Did you get it correct? Alright, well, that ends this video. Pharmacology doesn't need to be hard. Just remember what class the medication is under, and most of the signs and symptoms will be similar, as well as nursing actions and patient teaching. Good luck with your studies. Click here for another nursing video.